I'm extremely patient-centric, almost to a fault, and I impart that upon everyone who works with me. And it really comes from two experiences that I had myself. Unfortunately, my father died relatively young of a glioblastoma, so it's a brain tumor. And I watched how difficult it was for us to navigate through the healthcare system for the 9 months that it took from him having the diagnosis made to the time that he passed away. And that's with having a brother who's a physician, I'm a physician, and we still had a difficult time getting my father through that process. I can only imagine how difficult it is for others who don't have the knowledge that we had. And that really changed my way of looking at medicine and my way of looking at how we treat our patients. I wrote a short paper thereafter. I was the president of the Michigan College of Emergency Physicians at the time, and I wrote a short paper called Gaining Perspective and tried to explain to my readers what we went through and just how we need to change our system to make it easier for our patients to navigate. The other experience I had was when my son unfortunately suffered a head injury, and we took him to the emergency department, and he had to have CAT scans, and he was combative, and I made many, many deals with God during those 12 to 14 hours before he started to act normal again. And I know what it's like to be on the other side as well. And I think that's why I've changed my philosophy, and I'm, as I said before, very patient-centric. I trained in emergency medicine. I went to school at University of Chicago Pritzker School of Medicine and did residency at Cincinnati. I worked for roughly 12 years in the city of Detroit. I was a program director, so I trained residents at Wayne State University and then again at University of Michigan. I then had a role in the dean's office at University of Michigan, and then took on a role of overseeing 3 emergency departments at Beaumont in Michigan, 1 community, 1 semi-community hospital, and 1 academic. Very busy. Our biggest hospital was 130,000. The next one was 100,000 visits, and then our smallest one was 55,000 visits. So I have experience in really seeing everything from the community to the academic setting. And when it comes to research, my areas of research are in board certification and maintenance of certification, and my big area of research is in workplace violence. It is my goal that we will transform our emergency department to be very patient-centric. We're working on a lot of innovative ideas on how to use the space that we have. We are limited in our space, and how do we use it most efficiently to provide the best possible care we can to our patients in a compassionate way, and to help the institution with their issues of getting patients through the system as well. I think we need to break down the silos, and we need to work as a team and keep the patient the focus of it. And I think if we do that, we'll be able to provide the best possible care for all the citizens of South Carolina.